Hello everyone. So today let us see some points regarding uterine fibroid. So fibroids are most common in the African group of people and it's most common during reproductive age. Why? Because whatever the fibroids contain, they are more hormone responsive and most predominantly estrogen responsive. So it is more common in nulliparous women. If the parity is increased, it is a protective factor. And most of the fibroid, remember, it will not increase in size during the pregnancy. If a pregnant lady comes with a fibroid, don't do anything, just leave it alone. Okay. And whatever the smoking, if a lady is smoker, is she having high risk for fibroid? Yes, it's no, because smoking will reduce the estrogen level, so it's not a risk factors for fibroid. So coming to some genetics, so MED12, that is the MAD12, and HMGA2 is the genes which are responsible for fibroid. So whatever the fibroid is there, this is, if you consider this is a fibroid, this is the capsule. The fibroid is containing a capsule and this capsule is called pseudocapsule. This pseudocapsule contains the blood and from there blood will be supplied to the leiomyoma. So, if there is a degeneration occurs, where the degeneration occurs, my dear friends? So, you tell, because center is having least blood supply. So, if the degeneration occurs from the center. Whatever the calcification occur from the periphery. Okay, so that's about pseudocapsule or regarding capsule. Now, coming to the fibroid, there are two types of fibroid. One is true fibroid, another is false fibroid. True fibroid means it's a primary fibroid. False fibroid means it's derived from broad ligament. Right? Primary fibroid is true fibroid which is arising from, actually it arises from the broad ligament. Actually these two types are from broad ligament fibroid. So this arises from the broad ligament, either from the uterosacral ligament or from the round ligament or from the tissue which is in the broad ligament. So when this arises like this, uterine vessels, if you consider this is the uterus, right? Okay, this is the broad ligament. So which arises from the broad ligament, the uterine vessels will be always medial to it. However, the ureter, whatever is there, it may be either underneath or it can be lateral, anywhere. But if it is a case of secondary fibroid, what is the secondary broad ligament fibroid? That means it arises from the uterus. Whatever the fibroid will arise from the uterus and it will grow laterally. So whatever the uterine vessels, when it grows laterally, it will push uterine vessels and ureter laterally. So uterine vessels and ureter will always be lateral in case of secondary broad ligament fibroid. That is called false. It is not arising from the broad ligament, it is arising from the uterus itself. So these are the two types of broad ligament fibroid. Okay, so this is something related to broad ligament fibroid. So whether the patient of fibroid will comes with menorrhagia or hypomenorrhea? Yes, the patients of fibroid will come with menorrhagia, not with hypomenorrhea. Okay, and they may come with dysmenorrhea, that is they will have pain while menstruating, dysmenorrhea. So will they come with menouria? What is menouria, my dear friends? Menouria means between the uterus and between the bladder. See, this is the bladder, this is the uterus. Between the uterus and bladder there is a connection. So when she is menstruating, even the urine is passing. That is called menouria. This is not seen in fibroid. Okay. So for the patients who are with heavy menstrual bleeding, so in 2020 there is one thing called, which is FDA approved drug, that is Orion. Orion is the FDA approved drug which is used to treat heavy menstrual bleeding in the premenopausal women. So as I told already, calcification begins at the periphery and degeneration begins at the center. Okay, because the center portion is having the least blood supply. Now something called degeneration of fibroid. So the patient, assume there is a patient who will come, she is around 28 weeks of pregnancy and she will comes with the sudden acute abdominal pain and she is having fever, she is having raised WBC count. What you suspect? You suspect red degeneration of fibroid. So what is the treatment for red degeneration of fibroid? Nothing to do, just give analgesics, nothing will happen. Okay, so ma'am, it can be torsion. How you say just give analgesic? Yes, my dear friends, if it is a case of torsion, until and unless it is infected, you will not get the fever, you will not get the rise in WBC. What you will get is only the pain. If that is the case, you proceed with surgery. Okay friends, this is the difference between red degeneration of fibroid and torsion. Okay, so the red degeneration of fibroid and the investigation of choice is MRI. Right? So, whether the fibroid will undergo malignant change? Yes, there is chance of changing into sarcoma. Sarcomatous changes in the fibroid is only less than 0.5%. And the intramural fibroid is having higher chance of getting into sarcomatous change. Okay ma'am, I have heard something called parasitic fibroid. What is parasitic fibroid? Parasitic or wandering fibroid. That means whatever the fibroid is there, see this is the uterus. Okay, so the fibroid is like this. This is subserous fibroid. So this pedunculated fibroid, sometimes it may detach and it will go and attach to the omentum, and it derives its blood supply from the omentum, and it remains quite simple and it remains quite silent. That is called parasitic fibroid. The parasitic fibroid or whatever is wandering fibroid, that means it detaches itself from the uterus and it will attach to some other organs and derives its blood supply and continues to grow. In spite you do something called uterine artery embolization. Have you heard the procedure called UAE, my dear friends? Yes, I have heard it. UAI means uterine artery embolization. Uterine artery embolization. So there is a nulliparous mother, nulliparous girl who will come with a history of heavy menstrual bleeding. And will you proceed with uterine artery embolization? No, you should not proceed with uterine artery embolization because it will not preserve the fertility. Okay, so this is about uterine artery embolization. You will use some polyvinyl alcohol PVC material and you will embolize and it will reduces the blood supply. Even for uterine artery embolization can be done for fibroid to reduce the blood supply and to get avascular area during surgery, or you even do it in placenta accreta spectrum, that is placenta accreta, to reduce the blood supply to the uterus, so that whatever you proceed with hysterectomy, you will proceed with least blood in the operating field. You can proceed with uterine artery embolization, right? But the thing is, you should not do it in nulliparous mother because even a uterine artery gives a blood supply to the ovary, so it will hamper the ovarian reserve in the mother. Even though she doesn't want fertility, she doesn't want a child, but it will cause premature ovarian failure and it will cause premature menopause. Again, the menopause, early menopause is very bad to a girl, right? So this is all brief about the fibroid. Thank you everyone.